High blood pressure is often called the silent killer because it works quietly inside the body for years without causing pain or obvious symptoms. Yet it slowly damages the heart, brain, kidneys, and blood vessels, making it one of the most dangerous and widespread health conditions worldwide. To understand high blood pressure, imagine your blood vessels as flexible pipes and your heart as a pump that sends blood through them. When the pressure inside those pipes increases and stays high for a long time, the pump has to work harder and the pipes become stiff or narrow, eventually increasing the risk of heart attack, stroke, kidney failure, and other serious complications. Many people assume that if they feel fine, their blood pressure must be normal, but high blood pressure rarely gives warning signs early on, which is why millions live with it unknowingly. Some people may occasionally experience headaches, dizziness, blurred vision, nosebleeds, or shortness of breath, but these usually appear only when the blood pressure reaches dangerously high levels, so we should not wait for symptoms to check our blood pressure. Regular monitoring is essential. Blood pressure numbers have two values. The top number, called systolic pressure, measures how forcefully blood pushes against artery walls when the heart beats, while the bottom number, called diastolic pressure, measures the pressure when the heart relaxes between beats. When these numbers stay above the recommended range over time, the heart is under continuous strain. There are many reasons why high blood pressure develops: genetics, aging, obesity, lack of exercise, high salt intake, stress, smoking, excessive alcohol consumption, and chronic medical conditions like diabetes or kidney disease all play a role. But the encouraging part is that even small changes in daily habits can make a tremendous difference. For example, lowering salt intake is one of the simplest and most effective steps. Salt causes the body to retain fluid and increases pressure inside blood vessels. And since most salt comes not from home cooking but from packaged and restaurant foods, being mindful of labels and seasoning habits helps greatly. Eating more fresh vegetables, fruits, and foods rich in potassium such as bananas, oranges, spinach, coconut water, and beans also helps balance sodium levels naturally. Regular physical activity improves heart efficiency and reduces stress on the circulatory system. And exercise does not have to be intense. Even 30 minutes of brisk walking most days of the week can significantly reduce blood pressure and strengthen the heart. Weight management also plays an important role. Even losing just 4 to 5 kilograms can lower blood pressure numbers meaningfully. Stress is another silent contributor, as long-term stress keeps the body in a heightened fight or flight state, raising heart rate and tightening blood vessels. Practices like deep breathing exercises, meditation, yoga, slow evening walks, quiet time away from screens, or simply maintaining regular sleep can help restore balance. Smoking and tobacco use are major triggers because they immediately constrict blood vessels and damage their lining. Quitting smoking is one of the most powerful health decisions anyone can make at any age. Alcohol intake should be moderate or limited because it raises blood pressure and interferes with medications that help control it. Speaking of medications, many people are prescribed blood pressure medicines and some stop them when they feel better or believe the problem is gone. But high blood pressure does not disappear on its own. The medicines help the body stay balanced, and stopping them without guidance can lead to dangerous spikes. What's important to understand is that blood pressure control is a lifelong habit, not a temporary fix, but the habits required are realistic and achievable. When blood pressure is well controlled, the heart works more easily, blood vessels stay healthier, and the risk of major health complications drops significantly. Regular checkups, home monitoring, taking medications as prescribed, staying active, reducing salt, managing stress, avoiding smoking, maintaining a healthy diet, and staying hydrated. These are powerful steps that protect your heart. And even if blood pressure has been high for years, improving habits now can still benefit the heart and prevent damage from getting worse. Your heart works tirelessly every moment of your life, and giving it a little care each day goes a very long way. Understanding your blood pressure, respecting the signals your body sends, and being proactive with lifestyle changes are some of the strongest tools you have in protecting your health and ensuring a strong and healthy future.